So what about that autonomic dysfunction and gastroparesis? Clinically, you may see these patients wonder, like, don't they seem to correlate? All these POTS patients who can't eat and they're puking and they need NJ tubes. Well, prior data has not found any correlation, especially not in pediatrics. But remember, we have 4 tests. The autonomic testing too is expert opinion, not validated test. So this is tricky area because we don't have great assessment, diagnostic test. This study, though, from the Adult Gastroparesis Consortium is linking autonomic dysfunction, chronic nausea, and gastroparesis together. It's in a pretty large study that found that parasympathetic, so vagal dysfunction, was associated with delayed gastric emptying and more severe symptoms. So interesting. Aren't they just anxious? Maybe. They're all anxious, right? We know that patients with dysautonomia have an abnormal sympathetic activity, high activation. That anxiety should be actually part of their disorder. We should just count on that happening. But is it a psychological problem and the mental health problem that's driving the illness? Well, the gastroparesis data is interesting too. 24% of patients with adults from typically Adult Gastroparesis Consortium have large-scale data on this. Anxiety, depression is very common. This systematic review is fairly recent, correlated anxiety and depression with gastroparesis symptom severity. But there's several studies that have found this, that have higher symptom severity, but the disease etiology or the degree of gastric retention doesn't necessarily correlate with the psychological dysfunction. So probably reporting greater symptom severity, but otherwise no great correlations there. So what's the chicken or the egg? We don't know if it's an underlying mental health problem driving the disease, or if the gastroparesis is in the signaling. We remember those cortical inputs to the brainstem centers. Remember how the nausea and emetic signaling is triggered, and how can this fit the brainstem control of gastric function? Well, it does. So that does make sense that patients with higher anxiety have worsening nausea and worsening vomiting issues, perhaps worse gastric motor function because of that brainstem control of the digestive function. But it is so tricky to know the chicken or the egg. If just an underlying gastroparesis patients have such trouble and certainly the teenagers and younger kids with coping with the refractory illness and the evolving anxiety and depression that comes from an unresolved medical problem. So this is another area where we have a lot of work to do.